Conductive deafness is a mild deafness of about 15 decibels, so the patient can hear at about 40 decibels. Sensory deafness is a severe deafness of about 35 decibels, so the patient can hear at about 60 decibels. And neural deafness is a very severe deafness of about 55 decibels, so the patient can hear at about 80 decibels. Now let's see some audiograms. So if you see this audiogram, this is hertz, this is decibel. 25 decibel is the normal cutoff or the normal threshold, and air conduction, bone conduction, both these graphs are plotted below 25 decibels. Likewise here, hertz, decibels, 25 decibels is the cutoff, and both air conduction, bone conduction graphs are plotted below 25 decibels. So this is normal hearing or normal audiogram. In case of a conductive hearing loss, we saw there is an air-bone gap present, since the air conduction is affected whereas the bone conduction remains normal. So, hertz, decibels, 25 decibels is the cutoff. Your air conduction is affected, so it's above 25 decibels, whereas your bone conduction remains normal below 25 decibels. And we have an air-bone gap of about 20 decibels present. Likewise here, 25 decibels is the normal cutoff, bone conduction below 25 decibels, air conduction above 25 decibels. Similar graph here. So this is your conductive deafness. In case of a sensory deafness, we do not have an air-bone gap, but the loss is of about 35 decibels. So the patient hears at about 60 decibels. So there is no air-bone gap. Air conduction, bone conduction graphs both are plotted at about 60 decibels. 25 hertz is the cutoff. And there are similar graphs here. 25 hertz is the cutoff and 60 decibels is where both air conduction and bone conduction are plotted. This is your sensory deafness. And your neural deafness is a very severe hearing loss. So the patient can hear at about 80 decibels with a deafness of about 55 to 60 decibels. And therefore, you see no air-bone gap, air conduction, bone conduction both plotted at 80 decibels with a cutoff at 25 hertz. A similar graph here. And there are certain special conditions. For example, we have autosclerosis. Autosclerosis is a type of conductive deafness. So there should be an air-bone gap present. Your air conduction is plotted at 40 decibels and your bone conduction should be below 25 decibels. But like I said, it's a special condition in which there is a maximum hearing loss at 2000 hertz only in the bone conduction graph. And therefore, you see this notch here in the graph. Air conduction is at 40 decibels. Your bone conduction should ideally have been below 25 decibels somewhere here. But there's a maximum hearing loss at 2000 hertz where the patient can hear at about 60 decibels and then it recovers. This notch is known as the Karhat's notch that you see in autosclerosis. We have a noise-induced trauma. The graph looks similar to autosclerosis. The only difference being this dip or this notch is present at 4000 hertz in both the air conduction and bone conduction graph. The noise-induced trauma, this is known as this graph is plotted because of a noise-induced trauma. This notch is known as the Boiler's notch, or it's known as the acoustic dip, and the noise basically damages your outer hair cells, and that is why we have a hearing loss at 4000 hertz. According to WHO, if a patient is subjected to 85 decibels for 8 hours for 5 days continuously, you're going to have a noise-induced trauma. And according to the Indian Factory Act, if a patient is subjected to 90 decibels for 8 hours for 5 days continuously, he will have a noise-induced trauma, in which we have a Boiler's notch or acoustic dip with a maximum hearing loss at 4000 hertz in both the air conduction and bone conduction graphs. Presbycusis. Presbycusis is a condition we see in old age where there is a high frequency hearing loss. So if you see this graph carefully, you'll realize at a lower frequency of 500, 1000, 2000, there is no hearing loss. But as we go higher, 2000, 4000, 8000, the hearing loss is going to increase. This is like a rising curve. High frequency hearing loss in old age, which is known as presbycusis. We have a condition called Meniere's disease where we have a low frequency hearing loss. So like you see, in low frequencies of 500, 1000, 2000, 4000, there's a hearing loss. But as we go higher, the hearing loss decreases. So the curve is a sloping curve. It's a low frequency hearing loss in Meniere's disease. And if a patient has congenital deafness, usually the audiogram we plot is a U-shaped audiogram in case of a congenital deafness. Now when we plot audiograms, we have certain symbols that we use when we plot the audiograms and certain colors, symbols and colors. So it's easy to remember the color. Right ear, R is red. Right is R is red. So right ear is marked in red color, whereas the left ear is marked in blue color. And these are the symbols you will have to remember.